What we have found in our research is the family caregiver often reports more distress than the patient themselves. This is in terms of emotional distress. Often because of this uncertainty, they don't know what to expect. It's very stressful to be a caregiver and not feel prepared for that, a very important role. And the more that the caregiver's distress, the more difficult it is to be a good provider to the patient. We developed an intervention for both patients and their spouse partners to help both of them deal with the effects of illness. We found that the intervention had many positive effects on patients and their spouse partners who participated in the intervention. The intervention was especially helpful for spouses. Spouses who participated in the study had more confidence in their ability to manage the cancer. They had better communication with their husbands or partners. They reported using more active coping strategies to deal with the stress associated with the illness. These spouses also had better mental health and better physical health 12 months after this intervention.